Hi, I'm Dr. Kaytlin Krutsch. I'm a researcher and professor here at the Infant Risk Center at the School of Medicine at TTUHSC. The communities that TTUHSC serves are grassroots at their heart. We're a rural community. I come from a very rural community, and I came to the big city of Amarillo and Lubbock to be educated. And having gone out into other metropolitan areas, it's very different. You know, the people are different, the ideas are different, and without having the representation that we can offer through the university at TTUHSC, that identity kind of gets lost, and the ideas that we have here in our community get lost. And it's easy for people to dismiss things that we think are important or the challenges that we face. And so by us going to people and saying, hey, we're here, and our opinion and our lives and our space here matters. I think that that's just a really valuable thing that TTUHSC has to offer. So how do we empower our communities here with TTUHSC? And that's something that I focus on a lot in my research as a part of translation. So translation is the practice of taking knowledge and applying it to practice. So how do we do that, and why are we so bad at it? If you think about it, you know probably what you should be eating, and you know what you choose to eat, and they're not the right things. What you think is going to be your decision is not actually what happens. And so I think that really the key to making that happen is the people behind the decision. You have to know the culture of the community you're interacting with. You have to know what makes them work and what's not going to work whenever you work with them. And the way to empower that to happen, I think, is to take the people that are in the community. Take the ranchers, take the people who are in agriculture, and say, okay, what do we want to do here? How do we want to apply the science, and how do we want it to make it work for us? And you have to educate them locally in order to do that a lot of the times, because it's a real challenge. So we want to be able to say that what we know and what we think matters, and be able to integrate that with the knowledge that we have in order to make the best decisions that we can. So educating people from the community, I think it's really important to make the connections, because the connections that people have with their families and with their childhood friends, you're just able to speak in such a frank and open manner that's not present a lot of the times in the relationships that you make later on. A lot of people are afraid to say things out loud that, they really need to be able to say to have a transparent relationship. So, for example, whenever the COVID vaccine came up, you have physicians speaking to their patients saying, well, this is what the research is today, and the research might change tomorrow, and the research might have been different last week, but this is what we have to go off of. But really, that's a pretty short conversation, and it has to be, because you have a lot of patients. But at the end of the day, you're going to go home to your family, and your family says, hey, I had this conversation with my doctor, but I didn't ask them about this, or I was worried, I didn't want to say this to them. Or maybe they didn't even go. Maybe they have been afraid to make that connection. And I think that whenever you educate people in the community that they're at, you still have that level of trust that's so hard to build after the fact. They're going to talk to you in a way that it's just really hard to get otherwise. And so bringing people up from within the community in the way that TTUHSC is able to do is vital to empowering a community and to translating information. So to make translation of information and to empower the community that you're a part of, I think that TTUHSC plays a really natural role, because we're right here. You don't have to leave to get educated. You don't have to say, well, I really want an important and challenging career, but I can't get it here. You can get that here at TTUHSC, and that's what I've been really happy to find in my career here at the Infant Risk Center.